Edge work for the knee and standing, a progression from the sitting. So first one is edge work. The first one is nudging. Okay, we're going to find the edge of the movement, part of the point at which it becomes protective, and you just go up to it and away from it, up to it and away from it, and hopefully each time you go you get a little bit further into the motion before you hit the edge. You know, and if flexing the knee is what's uncomfortable, that's the direction you go. If extending the knee is uncomfortable, that's the direction you go. And you can go in between the two if both are uncomfortable. Okay, there's nudging. Scraping the barrel. For this one, you want to get most of your weight onto the other leg, and we're just going to draw a circle with our knee. It's almost like we're making a little hula hoop motion with our knee. We're trying to make it smooth circle as we go around. What you might find is that as your edge is uneven, so you're not going to have a perfect circle. But hopefully, as you gain freedom of movement, it'll likely become more and more smooth, and your circle will get bigger and bigger. Okay, now for stacking the deck, we're going to add something onto this previously uncomfortable movement. I'm going to put one hand on my lower leg and I'm going to push laterally. I'm going to put one hand on my upper leg and I'm going to push medially. And I'm going to maintain that pressure, and it's a light pressure, not much at all, as I bend the knee. Now this is a mulligan concept that I've kind of added to this. But that's one thing with these motions. This is nothing, several interventions could be used in this fashion. You add something on top of this movement, whatever it might be, whatever your previous manual therapy techniques or things that you like to use can be utilized in this way. Now if this one doesn't work, I'll tend to just go in the opposite direction. I'll try pushing medially with my lower hand and laterally with my upper hand. And we'll try the same thing. Okay. You can also, just like we did in sitting, you can rotate the skin. Try it that way. You can rotate the skin laterally. Try it that way. There you are, edge work for the knee and standing.